Hi, it's Sue Morris, and I have another super exciting video for you. So today we're going to look at Spacelab's Clinical Access e-learning. So hang on and don't get too excited.
From the Patient Census window, touch on Carlos. The first time you open any patient, the patient file opens to the Waveform's Clinical View. In addition to the View tabs at the top of the screen, there are action keys to the left of the Waveform data, unique for each clinical view. There is also a timeline at the bottom of the screen, just above the system control keys. The timeline reflects either 72 hours of patient data or the time since initiation of monitoring up to the current time. The Waveform view opens with all monitored parameters displayed in compressed view. To change the parameters displayed, click on the action key labeled Settings. To change the parameters displayed on the screen, click the white box next to the parameter label. Use the scroll bar in the Settings window and deselect each of the parameters except ECG by clicking the check mark next to Respirations, ART, PA, CVP, PRS, SpO2, gas, and vent now. After deselecting all other parameters, 2 leads of the ECG are the only 2 parameters displayed. When in the compressed view, you can choose from 1 to 5 minutes of compressed waveform data by using the drop-down menu in the upper right corner just above the waveform display. Select from
So it's selected from 5 to 2 minutes.
Use the double arrows to the right and left of the timeline at the bottom of the screen to move backwards or forwards for viewing additional waveform data. The double arrows move you to the previous page of 2 minutes in compressed view, 1 page at a time. Now we're going to practice saving portions of waveform data for documentation purposes. Carlos was admitted to the CV ICU in preparation for a coronary artery bypass graft surgery. While in surgery, Carlos was placed on bypass. Let's practice documenting pieces of waveforms while Carlos was in the OR on bypass. To choose a section of waveform data, touch the Save action key to the left of the waveforms. A prompt will appear on the screen asking you to select a start and end point. Touch OK. Select any specific section of waveform data, touch once where the strip begins, and a second time to select the end point of the strip. Choose one of the first 3 seconds of the strip and the last 3 seconds on the display. Any amount of waveform data from the compressed view screen can be selected. This will automatically highlight the strip section chosen for documentation, like an electronic cut and paste. An annotation window appears, allowing for comments. Once the annotation screen appears, type Off Bypass MG in the title section. The MG initials are a good way to highlight your work and locate them at a later date or time. Now type in the comments section EP paged at 1241. All comments will print out just below the strip waveform data when this data is printed. Now choose strip format before selecting OK so that when this section of waveform data prints out, it will print in strip format, which will include the background grid. Now select OK. For routine strip measurements, Click on the timeline below the waveform data at the point in time you wish to document waveforms. Today, we will select 8 a.m. on 4/26. Touch the selected point on the timeline. An orange bar appears on the timeline at the selected time. Before using the electronic calipers for measurements, touch the Analyze key to perform an analysis on all ECG waveform data for a selected time period. Analysis of ECG waveform data can be completed using the Analyze key available in either the Waveforms or Arrhythmia View. In preparation for documenting a routine strip using the electronic calipers, let's analyze in Waveforms. Touch Analyze. Once selected, a Select Time window appears on the screen. Choose 12 hours, then choose OK. Within the next few seconds, the analysis automatically occurs on all ECG data over the previous 12 hours. When the analysis is complete, a message appears on the screen. Now all calipers are available, providing automatic measurements including rate and QT measurements with auto QTC calculations. To use the electronic calipers, touch Strip to change from compressed view to strip view. To open the electronic calipers, touch the caliper action key to the left of the waveforms. Touch the QT label to choose to place these calipers on the strip appropriately.
So in this example, they've only demonstrated QT, but you are going to measure rate, QRS, QT, and PR. So if you were going to do rate, you would click on the red rate, and you would come up and you would click on the first QRS that you see. And then you will click on the next QRS. So you will see a red line show up over each of those QRSs. If you go down and hit the lock component, you will be able to move those two red lines that you've placed across, and you can march it through to see if your rhythm is regular or irregular. It's going to provide you a demonstration of QT and demonstrate how it gives you a corrected QT.
The QT key appears darkened, indicating selection. Now place the calipers by clicking the first caliper just adjacent to the QRS complex. The arrows beneath the electronic caliper labels can be used to place calipers specifically. Click again to place the second caliper appropriately. The QT and the QTC measurements appear automatically. Touch the Save Action key to the left of the waveforms. An information screen appears asking for selection of the middle of the 6-second strip, since most clinicians prefer 6-second strips for routine strip documentation. Select the area where you have placed the calipers. The 6-second section of the waveform data selected is now highlighted. An annotation window appears with a generic ECG message in the title section. To change the documentation, delete ECG from the title section and annotate with routine strip MG in the title. In the comments, type patient recovering well. Always place the caregiver's initials next to the annotation for identification. Now touch OK.
So for this specific comment, you're going to type in your rhythm analysis. So you would put sinus rhythm, atrial fib, whatever the patient's rhythm analysis was. You would have assessed the rate, the QRS, QT interval, and the PR interval. Nice thing about each of these is they're color coded. And when you click the lock, so over here is lock, when you click on it, you're able to move those calipers along and measure to make sure that your QRS is the same width across. But importantly, especially with heart block, to measure your PR interval and make sure that you measure more than one, especially if you suspect a heart block.
The waveform strip is stored in the Saved Events view.
Saved events up here at the top.
Once Arrhythmia View is selected,
so up here at the top, moving from waveforms over to arrhythmia.
The Arrhythmia View opens in the home screen. Home screen allows viewing of a short thumbnail snippet of clinical data to identify types of classifications of arrhythmias seen during the analysis just performed. A pause will always be in first position in the upper left corner of the home screen if one or more have occurred. Touching on any classification will open that particular type of arrhythmia class in the rhythm view, displaying a short thumbnail snippet of waveform data. The categories of arrhythmias will appear listed in order of priority. If a specific type of arrhythmia was not seen during the analysis because it has not occurred, it will not be listed on the home page. A definition of each type of arrhythmia classification is available from the operations manual. To open a type of arrhythmia, click on that category. Choose VE Run for ventricular run evaluation. The highest priority of each type of event is always in first position on the display. Identification of the length of each event will be visible along with the time and date of each occurrence. This will allow the care team to follow changes in the patient's condition over time for appropriate documentation of important condition changes and effective treatment of the patient. To open a thumbnail snippet to see a longer strip, click in the middle of the waveform of the thumbnail snippet. To document any event, click on the Save Action key and annotate. Remember to place initials next to the title of the event. Touch OK. Now let's choose another type of arrhythmia. Use the drop-down menu next to Type and choose Pause from the list. The classification appears in Strip View and opens the highest priority of that type of arrhythmia. The beginning and end of the pause will be marked with an orange tick mark, and the exact length of the pause will be identified to the right just above the waveform. If there is more than one of this type of event, touch the drop-down menu, which will include a listing of all the events of that particular type. Now touch Summary Report. The summary report appears and can be printed using the Print Report Action key to the left of the report. This report can be used for documentation purposes as a shift report, as a transfer report, or as a discharge report when the patient is moved from one department to another. It can also be used as a discharge report when a patient is sent home from the emergency department or from any other unit. All events are hyperlinked and provide a numeric notification of the number of instances that a particular type of event has occurred. For those patients with pacemakers, if the pacer key is on at the monitor, there is a pacer analysis listed at the bottom of the summary report with hyperlinks available for each identified pacer event. Hover over the arrhythmia type bradycardia now and click on it to see the associated waveform data. The bradycardic event opens in the Rhythm Waveform view. If you wish to save this event and add annotation for documentation purposes, simply select the Save Action key to the left of the waveform. To review all alarms over a selected time period, click on the Alarms view at the top of the screen. Setup.
So we have clicked 12 hours.
Alarms can also be filtered by parameter. To filter according to parameter, use the drop-down menu next to the parameter in the upper left corner above the thumbnail views. Choose ECG. This will show all alarms, both audible and visual events, which occurred on the bedside monitor. To select a different time period for review of alarms, choose 8 hours from the drop-down menu in the lower right corner. Move the orange bar on the 72-hour timeline all the way over to the right to view all ECG alarms over the most recent 8 hours of time. The red area just above the 72-hour timeline is a second timeline corresponding to the placement of the orange bar on the 72-hour timeline. Each time an alarm occurred during that 8-hour time period, it is indicated in the red section with a bar. To open an alarm, click on the bar. The thumbnail of the alarm is automatically highlighted with the title of the alarm. To evaluate number of occurrences of high-priority alarms over the past 8 hours, view the number of bars in the red section just above the timeline. There are 2 indicating 2 high-priority ECG alarms which occurred during that 8-hour window of time. All alarm settings are configured on the monitor. The red color corresponds to high-priority alarms, yellow to medium-priority alarms, and blue to low-priority alarms, as set on the monitor. To save or print an alarm, touch the Save Action key to the left of the waveform. To document, type the note of your choice in the title section and include the caregiver's initials. If you wish to print the event immediately, check the box next to Print while saving. Once OK is selected, the alarm will be saved and printed at the same time. Most of the clinical data views are time synchronized in an effort to assist clinicians with a more complete patient picture. To view numeric vital signs occurring at the same time as the waveform data from the alarm, click the Trends view. Now touch Waveform view and note the time aligns to the same time period. Touch the Trends view to view patient-monitored data. Numeric data is available according to duration and interval selections, and graphical data is displayed as a linear trend below the numeric data. To view only the linear trended data, deselect the Trends view to the left of the display under Show Trends by clicking on the white box next to the view you wish to deselect. Deselect Tabular now. Now the graphic linear trends are displayed without the numeric values. To display a numeric value reading over the linear trend, click on the trend at a specific point in time. An orange flag appears with associated measurements over the values. Views can be created to complement hospital protocols, patient types, or patient diagnoses. If purchased, a custom view can be created for a variety of conditions or protocols. Click on the drop-down menu next to View. Click on Cardiovascular View from the drop-down selection. The view will change to the display of your choice. To print vital signs according to duration and interval choices, use the Print Action key to the left of the data, or choose to print a report for a selected time period using the Print Report Action key. The Print Report allows you to choose a period of time from which to print data.
The print report under trends would be good for a patient who wasn't doing well on 5B step down. And that concludes our discussion of space labs today. What I want to bring to your attention is it is a nurse's responsibility to do an analyze and a strip measurement at the beginning and the middle of every shift. So somewhere between 7:30 and 8:30 in the morning and evening. Somewhere around 1:30 in the afternoon and 1:30 in the morning. If you're working an evening or a night shift, you're certainly going to assess the measurements and analyze your rhythm when you first come in to care for your patient. And then at the end of your shift, you do not have to do a measurement, but you do have to click the Analyze button. And so I would likely do this just prior to putting my morning report together. And I would want to analyze the patients that I had cared for in case I had missed an arrhythmia alarm. So instead of scrolling through and looking for atrial fib, if your patient has had a change in rhythm, then that will be documented. And when you analyze the rhythm, you will be able to see at the time that it started and assess the duration. So I think this will make your life a little bit easier once you become confident in your ability to use the components. So I thank you for your attention and have a great day.